Healthcare reimbursement. Steve Rowe, you'll be going first on this one. It's from a chamber member of the Eastern Maine Healthcare Systems. In 2009, the Baldacci administration satisfied part of several years of Maine care debt owed to Maine's hospitals, doing that by using federal stimulus funds, but he did not correct the structural problem in reimbursement. In other words, the debt's climbing at a rate of $250,000 each day statewide. It now exceeds $285 million for services provided over the past 3 years. The debt continues to grow, and there's no plan to pay it off. So here's the question. How do you propose to fix this problem going forward if you become governor?
Well, that's a good question. First of all, I would do this like I do everything else. I will pull people together and examine the issue. One of the things I think we're all going to talk about this, but I'm going to bring strong, smart, innovative people into government. And with respect to this issue, we'll find a way to pay for it. It needs to be paid off, and it'll be done, but we need a schedule of payments. I think one of the problems with health care, and I've heard this over and over, is that practitioners, if they provide services, they either get paid late or they don't get paid at all. And they're tired of it. And they're not taking, a lot are not taking Maine care patients because of that. It's wrong. We can't expect our people who practice health care to do that. They have families themselves. They have bills. We have to pay our bills. And the government has to pay its bills. So we will find a way to do this. We hear a lot about this structural gap. I believe that the doom and gloom that's being preached is not all true. I think the next couple of years are actually going to be better. We're going to see an increase in revenues of at least $300-400 million over the next 2 years. So I do believe that we will have the revenues to start paying this off. But we need to pay our bills. We can't have government be a lousy business partner. We have to pay our bills to the folks who are providing the services.
Libby Mitchell.
I find that a very intriguing question, and I find it an intriguing question because the government did pay its bill, and hospitals, I'm surprised, are still are saying that they're not being paid. We really have to check. We did pay the hospitals, and the debt is not increasing at such a rate. We have to look at how hospitals are being reimbursed in the first place. And in full disclosure, I'm a board member of a hospital and fight very hard for payment reform. But we have a huge issue in this state of how we're reimbursing hospitals and how we utilize emergency room care and how the billing is done. You can't bill people retroactively and have anybody figure out how much they're supposed to be paid. We have to create a system where hospitals are more transparent, and I think that's been an important thing. As you know, procedures across this state, the price varies wildly from one part of the state to the other, and consumers have a right to know that. I was very proud to support the Patient's Bill of Rights. We do need transparency. As you know, the state, in its efforts to control costs, has rated hospitals and says that if you're not a preferred hospital and a person who's insured by the state chooses to go to you, then they're going to have to pay a higher copay. And believe me, that gets the quality of that hospital up tremendously. We can work together on this, but it does not serve the people of Maine well to continue to talk the old talk. We have to discuss how we're going to create a system of hospitals that are efficient and quality, and we will pay our bills.
Pat McGowan.
This will be an issue, I think, going forward with this ongoing health care debate. It's how we will reimburse people. I've met physicians that have said they will no longer participate in Maine care. I've met people that have said that they don't want to have any dealings with the government as far as reimbursement goes. And I think that's going to be a challenge for us to bring back the confidence of a government that is the biggest provider, or in some ways, in the rural hospitals. I served on a hospital board as well in rural Maine. And part of the issue has been the bad debt, the uninsured, the emergency room patient that has no health insurance that walks out the door. If you're in a healthcare facility in Fort Kent and you're injured in the woods cutting wood and you have no insurance, the fastest way out of that emergency room is back to where you can avoid paying a debt. That debt adds up, and it will end up on the books in what he's talking about today with hospital reimbursement. We need to work toward coverage. That same individual who's working in Fort Kent can throw a rock across the river where his competition has complete coverage in a Canadian system of health care. We can do this by implementing the new health care reform in the federal government to the health care opportunities that we have in Maine by being ahead of the curve. Insurance, preventative care, these are the things we need to work on.
Rosa Scarcelli.
Well, firstly, I'll agree with you. We used our stimulus money to get caught up, and we were 48th in the nation in terms of job creation with our stimulus funds. So we used our money that was supposed to create jobs, and we put it into ongoing programs. This will be an issue that we are going to face. The next governor will face a shortfall. To say that we will have a large increase in revenue, I think is being unrealistic, but we need to be prepared for the worst. And the worst is that we're going to have at least $350 million of unfunded pension fund liabilities that we're going to have to deal with. That's a reality. We are going to have to deal with Medicare and Medicaid reimbursement changing. We are going to have to deal with the fact that we may have no growth in the economy. And payment reform is critically important. So the opportunity that faces the next governor is, how do you deal with this shortfall? Well, it's an opportunity to show transformational change. It's an opportunity to deliver services differently, and it's an opportunity to evaluate every single state program. And this has to be one of the programs that's evaluated. We must do things differently. And for the right person with the right leadership skills and the right vision, we will do it differently. We cannot continue with the status quo. We cannot continue thinking that we can pay our debts with one-time money. That money needs to be invested in long-term growth. We owe that. We cannot cut unwisely. We have to be investing, because if we don't invest, we won't grow. And if we don't grow, we will die.